Today's lecture in anatomy and physiology focuses on the axial muscles. Here's the outline of what we are going to discuss today. First of all, we will not discuss all the head and neck muscles. It's simply beyond the scope of this discussion. There are quite a few head and neck muscles. However, we will discuss the fundamental muscles of the neck, as well as muscles working around the spine. We will talk about the muscles of respiration, abdominal wall muscles, and we will finish off this discussion with inguinal ligament and inguinal canal. Muscles of the neck, sternocleidomastoid. Now, if you look at this name, sternocleidomastoid, sterno stands for sternum, cleido stands for clavicle, and mastoid symbolizes the mastoid process. It originates from the sternum and the clavicle. So the sternal head originates from the sternum, makes sense. The clavicular head originates from the clavicle. So you have your sternal head and your clavicular head. It inserts on the mastoid process of the skull. It is innervated by the spinal accessory nerve, and its actions consist of, when it unilaterally contracts, it rotates the head to the opposite side. When both sides contract, it flexes the neck. So its primary job is to flex the neck and to rotate the neck. And one thing I'm going to talk about shortly is, as I already mentioned, muscles only contract. So you have to follow the direction of the fibers. So when these fibers contract, it's going to make sense that it's going to rotate the neck towards the opposite side. And if the other side contracts at the same time, it's going to flex the neck. Muscles of the neck, Splenius capitis. Splenius means bandage. Due to its broad shape, it could look like a bandage. Origin, spinous processes of the lower cervical spine and upper thoracic spine. So C7 to T3. And then it inserts on the mastoid process, similar to the sternocleidomastoid. Its actions, when it unilaterally contracts, it rotates the neck towards the same side. When it bilaterally contracts, it extends the neck. So its function is also to rotate the neck and to extend the neck. Sternocleidomastoid versus the Splenius capitis. The sternocleidomastoid and Splenius capitis are antagonists with respect to neck flexion and extension, because the sternocleidomastoid flexes the cervical spine, while the Splenius capitis extends the cervical spine. The sternocleidomastoid and Splenius capitis work as synergists with respect to neck rotation, because both can rotate the cervical spine. For example, the left splenius and right sternocleidomastoid contracting at the same time rotate the neck to the left. One thing to note, that going forward, being able to look at the direction of the muscle fibers, the way that they run, can tell you what the muscle does. Remember, muscles only shorten. Deep muscles acting on the spine. Erector spinae. Erector spinae. Erector erects. Spinae spine. Its name is telling you what it does. And just in case you didn't get that, erector spinae helps extend the back. So it erects the spine. And basically, it originates from the iliac crest, sacrum, transverse and spinous processes of the vertebrae, and supraspinal ligament. Basically, it originates up and down the spine. Insertion. It inserts on the angles of the ribs, transverse and spinous processes of the vertebrae, and the posterior aspect of the skull. So essentially, it inserts up and down the spine, up to the level of the base of the skull. Its action, it extends and laterally bends the trunk, neck, and head. So basically, it keeps the spine erect and bends it from side to side. Side to side. Reminds me of an Ariana Grande song. Side to side. But anyway, that has nothing to do with this lecture. However, think of your spine as a bridge and the erector spinae as a suspension cables holding up that bridge. And if you look at this picture, the erector spinae are located here, so they're very deep because you have to cut the trapezius and the latissimus dorsi muscles away to see the erector spinae. Deep muscles acting on the spine, Quadratus lumborum. Quadratus lumborum, quadratus, four-sided, lumborum, lumbar. So it's a four-sided muscle in the lumbar spine. It originates on the posterior part of the iliac crest and iliolumbar ligament. So it originates on the upper part of the pelvis and inserts on the transverse processes of L1 to L4 and the 12th rib. Its function is to laterally bend the trunk. It fixes the 12th rib. So it stabilizes the hip and spine. And in case you didn't get that, this picture tells you it functions as a stabilizer of the hip and spine. Anyway, muscles of respiration, diaphragm. So the diaphragm originates on the lower aspects of the thoracic cage, and it inserts via a central tendon of the diaphragm. It's innervated by the phrenic nerve, which consists of nerve roots from cervical nerves 3, 4, and 5. So just think 3, 4, and 5 keep you alive. That's a good way to remember the innervation to the diaphragm. Action, inspiration, as you can see here. And note that the aorta, esophagus, and inferior vena cava pass through the diaphragm. So here's your aorta right here, passing through the aortic hiatus, your esophagus passing through the esophageal hiatus, and your inferior vena cava. Muscles of respiration, and these are the accessory muscles of respiration, your scalenes and intercostals. So you have an anterior, posterior, and middle scalene. The anterior and middle scalene elevate the first rib. The posterior scalene elevates the second rib, and this happens during respiration. And these scalene muscles are accessory muscles of respiration. The intercostal muscles are located between the ribs, as you can see here. That's why they're called intercostal. Intercostal means between the ribs. These are also accessory muscles of respiration. Now we're going to talk about the muscles of the abdominal wall, Rectus Abdominis. This is known as a six-pack muscle, or eight-pack if you're genetically blessed, which I am not. Rectus means straight muscle, abdominis, abdomen. So if you look at this muscle, it's straight and it's in the abdomen. It originates from the pubis and pubis symphysis, and it inserts on the xiphoid process and costal cartilages 5 to 7. It flexes the trunk. Now take a note of the linea alba, which runs down the midline of the abdomen. Clinically, this is incised in order to open the abdomen during surgery, especially if you're making a midline incision. Also note the tendinous insertions, which add to that six-pack look. It actually gives the rectus abdominis that six-pack look that people love. Muscles of the abdominal wall, external oblique. So the external oblique is external. Okay, it's the outermost layer right here. Oblique refers to the course of the muscle fibers. So note that the muscle fibers are running in an oblique direction. And also note that the fibers of the internal oblique are perpendicular to that of the external oblique. So external oblique, internal oblique. And it has a pretty broad insertion. It has a broad origin as well. It originates from the lower 8 ribs in the back, and it inserts pretty broadly as well. It inserts on the linea alba, it inserts on the pubis, anterior superior iliac spine, and the anterior half of the iliac crest. So it inserts right here. It flexes and laterally bends the trunk, and it also rotates the trunk. So it flexes, laterally bends, and rotates the spine. Muscles of the abdominal wall. Internal oblique. So your internal oblique is located internal to the external oblique. So it's here. An oblique again refers to the course of the muscle fibers. And again, note that the course of the muscle fibers of the internal oblique run perpendicular to that of the external oblique. And just like the external oblique, it has a pretty broad origin, which consists of the thoracolumbar fascia, anterior 2/3 of the iliac crest, and inguinal ligament. So it originates from back here through here, and it inserts pretty broadly as well on the lower 3 or 4 ribs, linea alba, pubic crest. And its actions are the same as the external oblique. It flexes, laterally bends, and rotates the spine. Muscles of the abdominal wall. Tranversus abdominis. Transversus means across, abdominis is abdomen. Is the innermost layer. Is the innermost muscle of the abdominal wall. And it has a pretty broad origin and a broad insertion. I'm not even going to bother to read these out. But its action is to compress the abdomen. Now we're going to finish off by talking about the inguinal ligament and inguinal canal. The inguinal ligament is formed by the aponeurosis of the sternal oblique. And some of you may be wondering what the hell is an aponeurosis. And an aponeurosis is basically a fancy term for a fibrous sheet or flat expanded tendon, which allows muscles to insert or originate from it. So muscles can attach to this portion. And the inguinal ligament, it runs from the anterior superior iliac spine all the way down to the pubis. The inguinal canal, which is here, contains the spermatic cord in men. So here's your spermatic cord. The contents of the spermatic cord include the vas deferens, otherwise known as ductus deferens, the pampiniform plexus of veins, the testicular artery, and the genital branch of the genitofemoral nerve, which is not really shown here. In women, the inguinal canal contains the round ligament of the uterus. The ilioinguinal nerve runs in the inguinal canal in both men and women. However, it lies outside the spermatic cord in men. And also note the location of the superficial inguinal ring. So in summary, the axial muscles, first of all, are muscles that act around the axial skeleton. They consist of the muscles of the head and neck, the deep muscles working around the spine, muscles of respiration, and muscles of the abdominal wall. The muscles of the head and neck, such as the Splenius capitis and Sternocleidomastoid, are antagonists with respect to neck flexion and extension, but are synergists in regard to neck rotation. The Erector spinae keep the spine erect, while the Quadratus lumborum helps stabilize the spine and hip. The main respiratory muscle is the diaphragm, while the scalenes and intercostals are accessory muscles of respiration. So the main guy is the diaphragm, and all the little helpers are the intercostals and the scalenes. Abdominal wall muscles from superficial to deep are the external oblique, internal oblique, and transversus abdominis. Please refer to the pictures that I have previously shown. The rectus abdominis flexes the torso. The oblique muscles flex, laterally bend, and rotate the torso. In men, the inguinal canal contains structures vital to reproduction. Injury to these structures can cause infertility. The inguinal ligament serves as a landmark for the inguinal canal and is formed by the aponeurosis of the external oblique. It's done. We're finished. Like this video, subscribe. Peace.